Welcome to our Medico Nerd channel, where we dive deep into the world of insurance and health and science education. Today, we're tackling a pressing issue that affects millions, the $1 trillion private health insurance scam. When we think about health insurance, we often envision security, peace of mind, and access to essential medical care. However, what if I told you that behind this facade lies a system that could be considered one of the largest financial schemes in history? Let's break it down. The private health insurance industry in the United States is a colossal entity worth over $1 trillion. This industry profits immensely, but at what cost to the average consumer? Section 1. The cost of coverage. To start, let's talk about premiums. According to recent reports, the average annual premium for employer-sponsored family health coverage has exceeds $22,000. This is a staggering amount, especially when you consider that many families are paying a significant portion of their income for coverage that doesn't always deliver. Moreover, high deductibles can deter individuals from seeking necessary care. In fact, a survey showed that nearly 30% of Americans stated they have avoided medical treatment due to costs. This is not just a statistic, it's a reflection of a broken system that prioritizes profits over people. Section 2. Hidden costs and fine print. Now let's discuss the hidden costs associated with the private health insurance. Many plans come with complex fine print, leading to unexpected out-of-pocket expenses. For instance, a patient might believe that they have coverage for a specific procedure, only to find out later that it was labeled as out of network, resulting in exorbitant charges. This lack of transparency is a hallmark of the industry, often leaving consumers feeling deceived. Section 3. The role of pharmaceutical companies. Next, we cannot overlook the role of pharmaceutical companies in this scam. The prices of medications in the US are among the highest in the world. A study found that Americans pay nearly 4 times more for prescription drugs than consumers in other developed countries. Why is this? Much of it comes down to the influence of insurance companies and the lack of regulation on drug prices. Insurance providers often negotiate price with pharmaceutical companies, but these negotiations can lead to higher premiums for consumers. Essentially, we're stuck in a cycle where profits take precedence over patient care. Section 4. Lobbying and political influence. Let's talk about the political landscape. The private health insurance industry spends millions on lobbying to protect its interests. According to Open Secrets, health insurance companies spend over $170 million on lobbying efforts in recent years. This financial clout allows them to influence legislation that could benefit consumers. ensuring that policies favor their bottom line instead. This brings us to a crucial question. How do we break this cycle? Section 5. Alternatives and solutions. There are alternatives to private health insurance that many are advocating for, including a single payer system or public option. Countries with universal healthcare systems often have better health outcomes at a fraction of the cost. For example, in Canada, healthcare is funded through taxes, leading to significantly lower administrative costs and improved access to care. It's essential to explore these alternatives and push for a system that prioritizes health over profit. Okay, the conclusion is the $1 trillion private health insurance scam is not just a catchy title, it's a reality for millions of Americans. As consumers, we must remain informed and advocate for a healthcare system that serves everyone, not just the wealthy few. If you found this discussion valuable, please like, subscribe, and share this podcast with others. Let's keep the conversation going. How can we work together to demand change in the healthcare system? Would love to hear your thoughts in the comments below. Thanks for tuning in to our Medical Nerd channel. Until next time, stay informed and empowered. More perfect union politics.